As usual at this time of year, we expect to see increases in things such as influenza and COVID, and we are seeing that according to the latest data. We've also seen quite a bit of RSV in the last couple of months, and this can be concerning because having all three diseases circulating at the same time can put an extra burden on our healthcare system. This can mean we could all see extra long waits to get into our healthcare appointments with our healthcare provider, and even a longer wait at our local hospital for an emergency department visit. Shandy Dirth, and I'm the director of the Center for Public Health Practice at the Richard M. Fairbanks School of Public Health. Holiday gatherings can impact the spread of infectious diseases, partly because we're just gathering together in close quarters. We're more likely to share respiratory infections if we're coughing or sneezing just because we're so close to other people. And it also offers more opportunity for things like foodborne diseases. So you're preparing food for other people. If you happen to have any kind of stomach issues, it's possible to pass on some stomach bugs to other people. So it's really important to make sure you're washing your hands well at this time of year as well, in addition to your vaccinations and other things that you can do to protect yourself. We have really easy steps you can take to help protect those loved ones who might be older or immunocompromised this holiday season as we gather. So the best thing you can do is get yourself up to date on your vaccinations, including your annual flu vaccine and your annual COVID vaccine. So you especially want to make sure you're up to date on vaccines before you head into a hospital setting or a long-term care setting like a nursing home, before you visit that loved one. Now, the only thing that's changed this year from last is that you need to go through your insurance provider now for your COVID vaccine. So whereas before the federal government paid for everyone to get their COVID vaccine wherever they want it to go, you need to make sure you're following your insurance rules and regulations. If you don't have insurance, you can contact your local health department. There's still a federal program to give free COVID vaccines to that population, so you can still get your COVID vaccine without having any insurance, and you still don't pay out of pocket. You just need to go to a different route. You can't necessarily go to the closest pharmacy like on your corner any longer. Stay home if you're sick, and although it's sad to miss out on those family gatherings, if you're sick, you really don't want to risk spreading that to another person. And right now, again, you can request 4 more free at-home COVID test kits through the USPS website. You can go ahead and test yourself with a home test kit, but what we're seeing now is often you have to be symptomatic for a few days for those home test kits to pick up COVID. So unfortunately, that's not as helpful as it has been in the previous years, but the big advice of staying home if you're sick is still in play. And if you're going to be traveling before you go see that loved one who's high risk, I would recommend going ahead and wearing a mask for those few days leading up to seeing that person. It's just greater protection that you can add to other things like your vaccination.